So my inspiration and motivation to be a user of iDialogs. Many times when I'm trying to assess people for uncontrolled diabetes, I'm presented with limited data. I can't use just an A1C number to guide my therapy or to tell me what would be a better or safer treatment option. So I'm really dependent upon the blood sugar values. The problem is it's labor intensive. The burnout or to maintain that high level of motivation to continue to monitor blood sugars frequently over long term it's difficult for people. This seemed like an amazing opportunity to provide people a tool to maintain a high level of motivation, to allow me to get better information more succinctly and improve my communication and decision making. So what features of iDialogs help me make better decisions, helps my decision making? I have a plethora of graphs and tables that can present the information to me just as I like it. Sometimes I want to see things graphically, sometimes I want to see things in a tabular format. I can customize it. I can hone into fasting and versus non-fasting blood sugar categories and compare blood glucose results to medication usage. The first thing I see when I look at the application would be sort of how the overall scorecard of a patient. And it's color-coded. If everything's green, the patient is monitoring frequently, they're meeting their blood glucose targets, and taking their medications regularly, I can very rapidly assess that things are going well and move on to the next decision. I have not seen data presented in a fashion like that. Also, when I do find something that I need to communicate back to a user, from within the application I can email that directly out to the patient with a snapshot of the image that's allowing me to reach that conclusion. So I have the information to reinforce my decision process, and then I can relay that back to the user, let them know what I'm thinking and why I'm thinking this, and help explain what treatment changes I wish to make. So iDialogs is different from other diabetes management solutions for several reasons. I'd say the biggest, most obvious, is that most of these other applications aren't solutions. They're simply places to store data, to compile blood sugars and present some basic statistics. They certainly aren't applications that at a high level improve adherence. Certainly don't improve my ability to communicate back and forth with the patient, to help improve engagement of the patient with his or her diabetes. Putting all that together makes iDialogs very different. It's not just a medication reminder, it's not just a blood glucose measurement reminder, it's not just a storage house for data, it's all of that, and setting it apart from anything else I've seen. The first users were hand-picked, and one of the motivations that I had were patients who were struggling simply to take their medications regularly and or monitor their blood glucose regularly to give me the information to advise them on what to do better. Some of the patients that I started initially on the system had very high A1Cs, and without really any change of treatment, just giving the patient the ability to remain adherent to monitoring and to give me the information to advise them more accurately, I saw rapid improvement in A1Cs. So clearly adherence was the issue. Simply me telling the patient every few months or so, you have to do better and these are the important reasons, that's typically not enough. Patients want to do better. They come because they want to be better. But that difficult nature of changing human behavior makes improving A1C that much more challenging. So definitely the important variable of adding iDialogs to the treatment plan made a difference. The applications are many. My focus is diabetes and related disorders, and so there are I would say with any chronic condition, a condition in which measuring some factor and maintaining motivation and adherence to a treatment plan, iDialogs would be very applicable. As we move in healthcare towards digital visits where the patient and I are not necessarily together, but the patient and I are remote, that would really provide a lot of information that I wouldn't necessarily have in the so-called e-visits. It would be as if the patient were with me, but I had the same quality data that I could obtain from any web-enabled device. I think that's another potential tremendous application towards the chronic wellness of chronic conditions. Absolutely. There is no downside that I've come across yet to using iDialogs with my patients with diabetes, because I find it easy to use, because I find that it helps me reach my clinical decisions faster and more accurately, because my patients become a greater partner in their treatment and helping them maintain high levels of engagement with diabetes. I find it very useful. Yes, particular experience that I've had with patients to help, that's helped them, yes. One patient who's new to iDialogs in particular has type 1 diabetes, and the measurement of blood glucose is especially important in type 1 diabetes. This is someone who I've worked with for several years and have had little impact on improving her control, primarily because of the inability to consistently monitor blood sugar. In the few weeks she's been on the system, she's measured more blood sugars than probably the last 2 years in total. We've made more changes and improvements with her treatment in the last few weeks than we have in the last few years. So I would fully expect her treatment to continue to get better, and therefore her A1C to improve and her risk of future diabetes complications to get better.